Hey, everybody. We're here with world-renowned expert Dr. Mark Kovacs. It's always a pleasure and an honor to have him on. If you don't know about Mark, he is a performance physiologist, researcher, professor, author, speaker, and coach with a extensive background training and researching elite athletes. He's trained a lot of top professionals and written some amazing books. I know you've trained John Isner, Sloane Stevens, Sam Querrey, and a bunch of others. And today we're going to talk about tennis fitness and how to level up your performance. So it's a fan favorite session for us to have Mark on and just to answer a bunch of questions from the audience. I have a lot of questions myself. I was also in Atlanta. It's time flies, but I guess it was several months ago now, and took a lesson with Mark, and it was so eye-opening, and he fixed a bunch of my technical issues. So it's really great to have you on, Mark. Thanks for coming on.
Yeah, thanks so much for having me. Always really enjoy this. It's always a great time. So thanks for all you do.
Thanks a lot. Thank you as well. Thank you as well. And everybody, definitely check out the Kovacs Institute. There's a button right below this video, so just click it and check that out. But Mark, I guess let's start with performance, speed, and strength, if that works. What would you say is the number one limiting factor that most recreational players face when they're trying to move faster on the court?
Yeah, I think it's a great question. And again, it depends a little bit on the age of an athlete. Obviously, as someone gets older, if they're not doing the right training, they slow down. They lose their recognition or cognitive ability a little bit to pick up the ball as soon as possible. So that's one aspect that makes people slower, even though they don't think of that sometimes. And then the signal from the brain of the muscle, that how quickly can you get that signal. So those two things happen before you even start moving. So those two are big ones that are controllable. You can work on those. And then when we're talking about truly moving to the ball, it's force into the ground, and it's how quickly can you apply that force. That's what makes people move quickly. And as individuals age, that ability, one, to generate force may decrease if they're not doing the right off-court training. So if you're not doing heavy strength training and things like that, you're going to reduce your force production. And then the speed aspect of what we need to do, delivering that force quickly, you need to work on things like speed training or plyometric training. One of the best things that we've seen over the last decade is the great research on the value and benefit of power and speed training as someone ages, because it used to be thought the older you got, the less of that stuff you should do because it was riskier. Which obviously there's a little bit of risk to anything that you do, high force, high speed, high power activity. But in general, you want to maintain your power and your speed as you age. So I'm speaking more to the older recreational player right now that may think, hey, their days of moving quick are past them. That's not necessarily true. You can definitely move faster. So that's the physics of moving. That's the things that we know will make you move faster. Then there's a technical piece which is relevant to all levels of play. That is, are you taking the right amount of steps? Are you doing the step coordination correctly? And are you positioning yourself to the ball at the right time? I see way too many recreational players move too quickly to the ball and then don't know where to position their feet. That's an issue many times. Or the second one is they don't recognize soon enough, so they're very late to the ball. Both are problematic. So you need to practice not only getting faster and moving better, but also making sure that you're more efficient with the steps that you take so that you actually get to the ball at the right time, set up like a pro sets up, and be able to hit the ball then effectively. Because very many times, and ask yourself if you're listening or watching this, do I hit really well if I hit like 10 in a row from the same spot? If you do, but then you get into a match and you can't replicate that, that's typically a movement issue. Because if you're in the same spot and you hit the same ball over and over and again and it feels good, you do well with it, that means your stroke technique is actually probably pretty good. The problem is you don't get to the ball correctly. So that's why in matches, you don't have as good a success with hitting the ball. Whereas when you watch the pros, they're pretty good from just about anywhere on the court because of their movement, not so much because of their strokes.
Yeah, I really like how you divided the different areas. So I guess are these the right categories? One is like cognitive based. One is the strength training and speed training, and then the other is the movement efficiency.
Yeah, exactly. So the way I
Okay.
refer to it is your reactionary skills to the ball, which is a cognitive component. Then you've got actually how good an athlete are you if we were testing your athleticism, strength, speed, power, capabilities, not necessarily tennis specific, but just general athleticism. And then the third is how good of a tennis mover are you from a tennis footwork and movement perspective. So if you can
Hmm.
train all three of those, you're going to be a much better mover on the court.
So I suspect that, the answer, as with many things, is probably it depends. But is there one of these areas that I guess we would get the most ROI on, return on investment, that we should be focusing on, assuming demographics of 40 plus?
Sure. Yeah, if you had to pick one, and obviously it's hard to pick one only, but if you were going to prioritize, the tennis footwork and movement is going to give you the biggest bang for the
Mm.
buck. Reason being is that is the efficiency piece of all of this. Hey, if you're set at your force and speed capabilities, you can get a lot better just by working on your efficiency of movement. If you don't recognize the ball that well, you may be a step late, but you still may get there okay and do a decent job if you've got good footwork. So definitely the tennis footwork and movement piece is going to be priority one. And then realistically, if you can get your athleticism up, that's going to account or take over if your recognition may be a little bit slow. So that would be
Mm.
number two, and then recognition would probably be three. But again, it's really
Uh,
hard, obviously, to be a great mover if you're not good at all three.
yeah, that makes sense. So probably not an easy question, but for amateur club level players, what steps should we take? Like, let's say we're listening, we say, "Oh shoot, I want now. I've been instructed to focus on my movement. So what steps should I take?"
Yeah, I mean, there's a few different things. One is obviously work with someone who does a good job on tennis footwork and movement. Unfortunately, many times it's not really addressed very well if you're talking about traditional tennis lessons. Most of the time it's stroke technique, it's strategy. Tennis footwork and movement in many scenarios aren't addressed as well as it could be. At the higher performing levels, usually it is. But at the recreational level, a lot of the time, the lessons aren't focused on that. They're focused on other things. So find someone who is good at that would be obviously the first thing. Two, there's a really good free resource from the International Tennis Performance Association, the ITPA. It's called Tennis Footwork and Movement, and it was a review done on all the major footwork patterns that are done on the court. The significant movement patterns. So you can actually look at that and just go through it and see, okay, what are the movement patterns that the pros do and how close am I to doing those movements? So that would be one. And then through Kovacs Institute, we have a movement course. If you really want to get into the details, do the drills, get really advanced with it. So those would be sort of 3 or 4 ways you can get started, sort of just understanding, do you move well? Many people don't even know. A lot of people will come to me and say, hey, I played tennis for 15 years, but I'm not even sure if I move well. Am I efficient? Do I do it the right way? And then you look at them and you're like, hey, on your backhand, you move okay. On your forehand, you move terribly. Or you do okay when you're moving forward, but you do really badly when you're moving sideways. So having a decent evaluation can be helpful just to set a baseline of where are you and what are the things you need to work on.
Yeah, that's really good. I feel like you can pair the movement course with maybe recording yourself moving and analyzing on the different
Correct.
strokes. That'd be really good. And yeah, we'll have a link for the tennis footwork and movement resource. So that's great. Um, so when you mentioned getting a good coach for footwork, I think I was on a walk years ago and I saw there was like a footwork training facility, but I don't think it was necessarily specific to tennis. I was wondering, should we get a coach who's specific to tennis, or could we also just get somebody who's like a footwork expert, but maybe in like a different sport?
Yeah,
I
it's,
mean,
it's
would
a
that still
great
help?
question, and we've seen a lot of challenges with that actually when you're talking
Mm,
about working on. So I did a lot in my early career. I did a lot of NFL combine prep, 40-yard dash. Then I worked with a lot of sprinters, 100, 200-meter sprinters. And that's how I got my training and learning. I wanted to work with the fastest athletes in the world. And we did a lot of precision work for their specific movements in sport. And a lot of it has to do with improving ground contact time, improving force into the ground, improving angles of contact, really, really specific stuff for running basically in a straight line or cutting, in a predetermined way. Whereas tennis is a lot reactive, and there's a huge component that you're not actually moving as fast as possible most of the time. You're actually moving at about 60 to 80% of your max most of the time, because you're watching the ball, you're trying to evaluate what steps you're going to take. So tennis movement is very different. I usually say and recommend people, don't go to a general speed and movement trainer if you're trying to work on tennis movement. It's better to go to someone like that if you go on to do strength and conditioning. They're usually really good at strength training, at some plyometric work, at some non-specific tennis athletic development work, which can be very valuable. That's sort of that second bucket we were talking about earlier, of developing speed, strength, and power. And that can transfer really well. But if you're trying to work on tennis movement, you have to sort of work on tennis movement. You have to work on the drop step run around forehand. You have to work on the front crossover recovery step. You have to work on, moving in forward diagonals to cut off short balls. That's really unique to the sport of tennis. And training for these other movements could help you a little bit in general athleticism. But in my experience, doing this for a long time and working in those other sports for the way they're trained, the transfer is not as good as you would hope. It's better to focus on your strength, speed, and power in the general sense, and then very specific work on your tennis footwork and movement. And great tennis coaches are usually really good at this. But there's a lot of tennis coaches, unfortunately, that maybe haven't done the training in that area, or it's not an area of specialty for them. So just be careful about who you're working with to make sure it's someone that is skilled in that area.
Thank you for the advice, Mark. So kind of working backwards from the movement to now the strength and speed training. I guess just generally speaking, what are the big things that, the keys that we need to like keep in mind, like, for these two elements in terms of like what should we hone in on training and what should we maybe like discard as not so helpful?
Yeah. So first off, you have to get your lower body strong, stable, which are the two big things. Really, you want to make sure that you've got good strength through your hips, especially your glutes, especially your ability to drive force into the ground. So typically lifting something heavy from the ground is valuable. That's like a trap bar or a hex bar deadlift, pretty simple activity that most people can do. It's one of the safer, heavier weight training type activities. It's probably a better option than, say, a traditional squat for most people, especially as individuals are getting older and maybe they haven't trained like this before. So that's one that is usually a staple of most people's programs, because it's a good way to add strength relatively quickly, relatively safely. So that's one really good one. And then you want to incorporate sort of a series of lunges, because, tennis is a lunging sport. So forward lunges, side lunges, crossover lunges, back lunges. There's a whole series of things you can do in lunging patterns that will really hit your legs, especially your adductors, your quads, your hip flexors, your glutes, and it gets a little bit of hamstring as well. So that's going to be really important. And if that was the only two exercises you did, you would actually do reasonably well. It's obviously not a full program, but those two by themselves will provide a lot of value. So that's, from a strength standpoint, is really useful. And then when we're trying to develop that lower body, if you look at all the great tennis players, what do we see? We see a relatively smaller upper body typically, and a pretty good size, backside and good side legs. That's kind of somewhat similar to, because it's a movement sport. Tennis is a running sport. You have to be a great mover, and you have to use your engine, which is really the lower body. So that's going to be priority one. And then obviously we got to do some strength work on the injury prevention side of tennis, which is your hips as well. So there's some smaller movements that we want to do for the hips, for the calves, because especially as we age, calf injuries really become problematic for a lot of older players. So you want to strengthen your calves, especially eccentric strength. So if you're not sure what that is, speak to sort of your trainer or get on a program and say, hey, I've heard I've got to do more eccentric strength work, especially on my calf muscles. That's going to try to help prevent those annoying calf strains that really set you back months typically if you get one of those. And then also if you've had a calf strain in the past, just because you feel good again, you know you're at a much higher risk of a second calf strain because you've had a previous injury. So don't give up on the training because you want to prevent that in the future. And then from an injury prevention standpoint, upper body wise, we know we have to address, our lower back is always going to be a priority. It's the number one injury site for tennis athletes. And that's about at all levels, but it gets worse the older you get. But it's not really a tennis injury. 70% of the population has lower back injuries in general. So it's just generally a human body issue. And because you're active and you play a lot of sport, you're at a slightly higher risk because you're stressing it more. So make sure that you're doing your core exercises, you're doing your lower back exercises, focusing on that. And then obviously take care of the shoulder and the elbow. Depending on your strokes, wrist may or may not be an issue. At the higher levels, wrist has become a major area of focus. Juniors, pros, collegiate players, that's become a major area of concern is wrist injuries and trying to make sure we strengthen those. But in the older players, you usually don't see as much of a wrist issue because their technique is not as extreme. Their grips may not be as extreme and their swing speeds are not as extreme. So we typically see a bit more shoulder and elbow issues than wrist issues.
That's that's gold. I took so many notes, Mark. So wow. So first off, a lot of follow-ups for me is you mentioned the Hexar deadlift as a potential replacement for the squat, I guess, for like, or at least it being like safer for folks to do. And I love the Hexar deadlift. That's probably my favorite exercise. But and maybe a selfish question because I also do the squat in addition to the Hexar deadlift. Do you think that's a bit duplicative for me or in others, or do you think it's still good to have
Yeah,
something
no.
like
I mean, a squat is a great exercise. There's nothing wrong with squatting. It's just hard sometimes to add it to an individual if they've never done it or if they've got, minor issues that they're dealing with in the lower back or the hips or something like that. So that's why I usually focus a bit more on the hex bar deadlift, but squatting is still a very good exercise. And it's not like one or the other. Usually you would do both. You could do both in the same session, but ideally you'd probably do those in separate sessions. So you go heavier on your squats one day, heavier on your trap bar deadlifts another day. So that would be your heavy compound activity for that day. So it's definitely something that I do with most of the athletes I work with. They're gonna squat, they're gonna deadlift most of the time, unless there's some reason in our testing that would shy away from squatting.
Got it. When I've when I work out, probably mistakenly, I have this mentality of I'm always trying to get the PR, hit. But you'd mentioned to go maybe heavier on one of these big exercises and then not as heavy on the other. Is that in terms of like volume, or is that also like maximum weight, or what's the approach?
Yeah, it's a great question. So it all depends on what phase of training you're in, what your goals are. Obviously, you shouldn't do the same program all year. So everyone we work with are in phases. So phases are usually determined by their competitive schedule. So they may have a heavy competitive block where they're playing a lot. So volume's going to be less during that period, but we're still going to go relatively heavy. But it's just the volume's going to be reduced significantly during an off-season training block or a preseason training block where physical focus is prioritized, then our volume is going to be much higher. So it's not an easy question to answer. It's all about where are we in the phases of training. So if our physical focus is I want to put on strength and get as strong as possible, I need my volume to be a bit higher and with good intensity. Intensity is typically percentage of 1 repetition max. So if you can squat 200 pounds, 90% of that will be 180 pounds. So that's a high number. That's considered relatively high intensity. And you would do that, 1 or 2 times. That would be all you could handle. Whereas if you did it, 100 pounds, which is 50% of your maximum, you did that 5 times, that would be considered lower intensity workout that day, because your total volume would be actually higher if you think about it. So if you did 180 times 2, what would that be? That would be 360. Whereas if you did 100 times 5, that would be 500. So you're actually doing more total weight doing 5 reps of 100 than 2 reps of 180. But the intensity was higher because you were closer to your maximum on those 2 reps. So that's where understanding how that affects your body from a nervous system perspective, from a muscle fiber type recruitment perspective, from what are you actually trying to improve. That's why you need to work with someone that truly understands that difference. You're still going to get benefits if you do a generic program, let's say a 3 set of 10 program where you gradually increase your weight week after week, and you do that for 3 months. That's not a bad starting point. Like if you don't know what you're doing and you're just getting started, you're going to see improvements on any program as a beginner. But once you get 3 to 6 months into consistent training, then you really want to make sure that you work with someone who can personalize it to what you're trying to improve on, make sure that you're progressing quickly enough without overdoing it, and then also making sure that it's getting at the things that you need. Because there's a lot of players that are very strong. They don't need extra strength. Always the question we get is, how strong is strong enough? And that's an important question to answer. For most people, they're strong enough. They're not functionally strong, meaning that they can't move that strength in the required directions. Think about a squat. There really isn't a movement on the tennis court that is truly a squat. Most movements on a tennis court are more lunging variations, leaning to one side or the other, one-legged movements, things like that. Very rarely are we standing on both legs, putting even amount of weight through both legs, not jumping, and just trying to lift something very heavy. That doesn't simulate anything on the tennis court. So we have to be careful of understanding that lifting heavy weight is important, because it develops a certain muscle recruitment that we need. It develops a stability that we want. It creates resiliency, but that can't be the only type of training you do. You have to add to that with more of these tennis-specific functional, so-called functional movements. I prefer the term tennis-specific strength training than functional training, because we are trying to make it as tennis-specific as possible.
Yeah, definitely transferring the strength into specific movement. Great stuff. Let's see. I'll go to the comments now. I know I've asked you a bunch of my own questions. Alexei, hello. Great to see Mark again. Good to see you. Rockchild, I find the older I get, the more time I have to take to stretch my leg, arm, shoulder, and back muscles before I walk out on the court. Why is that?
Yeah, great question. So as all of us age, things stiffen up. That's part of aging, unfortunately. However, we can reverse it, actually truly reverse it with training. And there's hundreds of studies that have shown this, that flexibility is actually one of the easier things to improve if you do it consistently. Most people aren't consistent with it. So doing it just before you walk out on court is obviously better than nothing. But if that's the only time you do it, you're not going to see great benefit. You want to make sure that you're doing it on a daily basis, and ideally multiple times a day. It doesn't have to be for very long, 5 minutes, 10 minutes, that type of number. But if you can hit that twice a day, you'll be surprised in 2 to 3 weeks how much better you get. And then in 2 to 3 months, it'll be significantly better. But yeah, you're not confused. As you age, you do need to stretch more to get that same range of motion, and also to feel like you're loosening up. There's actually some truth to that as well. So now we have the ability to use devices that can help with that. So there's electrical muscle stimulators, there's heat, there's all sorts of things now that is a lot more accessible that can speed up that process. Meaning that if we heat something and stretch it, we get a better benefit than if we just stretch it. So typically I say try to heat the thing up while you're stretching it or just before you're stretching, because you'll get a slightly quicker result than just stretching alone.
Yeah, brilliant stuff. Thanks, Mark. Thanks for the question as well, Rockchild. Just highlighting Jorge, brilliant coach as well, and great session today on mastering the art of disruption and sabotage. Let's see here. Oh, hey, Michael from Chicago. Great seeing you. James, how heavy is heavy when lifting for tennis? And then a follow up, maybe specifically for lunging, squats, RDLs.
Yeah, great question. So it's a hard one to answer for you individuals without knowing their history. But in general, I'll give you a couple reference points. So in high level players, what we're looking for, let's say if it's a hex bar or trap bar deadlift, we're usually looking for a 1 rep max range. Doesn't mean they're going to get there, but they should be able to lift about 2 times body weight. 2 to 2.5 times body weight is kind of what we typically see in strong tennis players. So if they're, let's say, 150 pounds, 300 to 350 pounds on a hex bar deadlift. Doesn't mean they're going to be lifting that weight all the time, but if we were going to test their 1 rep max, that is where they would fall. So that's a reference point. For most adult competitive players, you don't need to necessarily get to that level. But if you're 1.5 times body weight, that's a really good number. So, if you're trying to talk about, if you're 150 pounds, something like a 225 is a really good number to get as a floor. Anything above that's good, but trying to get that as your floor is something I usually recommend. Male or female. So don't feel like, if you're a female, you shouldn't feel comfortable, you shouldn't be able to do that. So that's always a good starting point. So 1.5 times body weight is a starting point on a hex bar deadlift. On lunges, it varies a little bit because flexibility comes into it and depth of movement comes into it as well. So I never like to give an exact number on lunges, but in general, you want to be able to do about half body weight minimum for multiple reps. So if you've got, that's dumbbells in both hands, let's say, so you combine them. So if you're talking in pounds, let's say if you're 150 pounds, you want to be doing, give or take about 40 pounds in each hand, something like that. So that's pretty heavy for most people. Most people may struggle with that, but that's kind of where we're trying to get to. So not expecting you to be there today, but that's something to work towards. Then if you want to just do general strength, when we're talking about, what are people that are trying to live forever, trying to live to 100 kind of concept. We know one of the better predictors is general overall strength. And, farmer's carries is a really good test for a lot of people. That's where you just hold dumbbells by your side and you walk, and you try to walk for 60 seconds. So 60 seconds is 1 minute. And some of the data is trying to suggest you should get close to your body weight. So if you're 150 pounds, that's 75 pounds in each hand. So that's pretty heavy if you actually think about it. I don't recommend that to start with because most people can't even lift 75 pounds, let alone walk for a minute with it. So usually start at 50% of your body weight, see if you can walk for 60 seconds, and then slowly progress with the goal maybe at some point of getting up in that range, but make sure that your technique doesn't break. I've seen too many people try to do something like that and their technique breaks down. So be very careful when you're working with heavy weight. So hopefully that was helpful with just giving some reference ranges.
Yeah, that's brilliant. Thanks a lot for these. A lot of great weight goals to look forward to and work towards. Liz, nice dog there. Any benefit to one's game with bench press, or should we focus more on hex, deadlift, and squat for the major lifts?
Yeah, so bench press is an interesting one. So it's one of those ones where tennis players in general are very overdeveloped in their chest anyway because of they hit forehands, they hit backhands all day. So you're always in this position and you're hitting serves. So you're already really overdeveloped in those anterior muscles of the body. So we shy away from doing excessive amounts of it. We're going to do a lot more rowing and pulling activities, so back exercises, to try to offset how much overdevelopment we see in tennis players anyway. However, doesn't mean we won't do some pressing movements, but typically we'll do floor pressing. If you're not familiar with that, we'll use dumbbells most of the time, and you'll actually lie on the ground. And the reason you lie on the ground is because your elbows get blocked at the floor, so you can't go below a 90-degree angle. The reason for that is it's putting less strain on the shoulder. So we used to also, when we did bench pressing, we would actually use a big pad on the chest. So you would only drop the bar about, let's say 6 inches above the chest, and it would hit a pad. And that would allow you to sort of mimic the same thing. So the goal there is just to put less strain on the shoulder, and while we're still getting some work done there. So, but in general, you deprioritize the pressing movements, over prioritize the pulling movements, because tennis players already are overcompensated and they're sort of overdeveloped already in their pressing abilities, and they're not as good in their pulling and rowing abilities.
Yeah, that makes total sense. That's totally me as well. My pulling and rowing is not as strong as the pushing movements. Great stuff there. Snowy. So serve technique question. Serve, for the platform stance, what is the weight distribution between legs at the trophy position when the legs start driving to push up? Does one of the leg joints dominate the leg drive?
Yeah. So with this, I think some people misinterpret what the data says. So during stage 3, the loading stage, which is sometimes called the trophy stage, at the beginning, when you're sort of loaded on the back leg, the best servers are close to 60-40, 60% on the back leg, 40% on the front. But as you start coming off the ground, that shifting has occurred from the back leg into the front leg. So it's closer to 60-40 front to back once their toes are basically on the ground and the rest of their feet are off. So I think a lot of people maybe misinterpret what the data is, saying, it's all off the back leg. It's not all off the back leg. It starts on the back leg, and then there is a shifting of movement as you're starting to come off the ground. So just like any other movement, you're not going straight up. Think about baseball throwing, football quarterbacks, anything requiring overhead activity. There is a loading component to it, and then there's a releasing or an acceleration component to the movement. The acceleration aspect, when you move that lower body, it doesn't move straight up vertically. It actually moves up at an angle out into the court. So that's where that comes from. So it's a really good question. The practical answer needs to be focus on your back leg, because that's where it starts. You've got to get that position right. And then try to make sure that you go up and out into the ball. And then you shouldn't have to worry about what my percentage is as a player. A lot of this is more biomechanics talk. Coaches talk to other coaches about it. But practically speaking, you shouldn't be thinking in that much detail when you're working on your serve.
Thanks, Mark. And then the same applies too for the pinpoint, right? You're going to start with 60-40 back leg and then weight transfer, right?
Correct.
Okay, beautiful. Let's see here. Liz, again, I know dynamic warm-ups are important, but what about cool down? Then you talk about how long a proper cool down should be following a 2-hour doubles match, and what types of stretches should be involved.
Yeah. So just look at the pros to see how much emphasis they put on cool down. So if you look at the workout areas in all these pro tournaments, they've tripled or quadrupled in size over the last decade. Reason being is players understand how much better they feel and how much better it is for their body to do an extended cool down. And there's multiple reasons for this. Cool down has multiple purposes. For many athletes, they actually do a mini workout as part of their cool down. So, if you watch some other sports, say basketball, for example, they'll actually do a 20-minute workout after a game, and then they'll cool down. So they'll finish their game, they'll do a workout, and then they'll do their cool down. Some pros do that as well, because when you're on the road so much, fitting in workouts during tournaments is really, really hard. I'm assuming you're asking this not from a workout standpoint. You're truly asking this, how do I do this to recover better for my next game? So that cool down period typically is you want to do some type of very mild activity. So that could be riding the bike. You see most of the pros, there's plenty of bikes now at all these tournaments. So they'll ride the bike for 10 to 15 minutes, usually drink a protein shake of carbohydrate protein shake at that time, because you want to get some calories in to refuel at that time, which is really important. So that's a great opportunity to do two things at once. Then once you get off the bike, and if you don't have a bike, walk around the courts. You can just walk at a zone 2 heart rate, which is whatever that heart rate is, where you can still keep up a normal conversation. So call a friend, speak to a colleague, whatever it is, a teammate, walk for 10 to 15 minutes can do the same thing as riding a bike. And then you go into a stretching and mobility routine. And the reason for that stretching and mobility routine is because we know after a tennis match, all the joints basically have tightened up. We used to do quite a few studies when I was at the USTA a long time ago on our junior players, who obviously are in great shape. But we found that there was a 10 to 15% reduction in range of motion in shoulder function after a 3-set match. So their internal range of motion of their shoulder had been reduced by 10 to 15% just by playing tennis. That would obviously come back over a 24-hour period, pretty close to normal. But over a year, they would lose a few degrees in internal shoulder rotation range of motion because of that over an extended period of time. So you need to work on resetting your range of motion after you play. So that's why it's really important during the cool down to go through a full stretching routine and make sure you focus on the major joints that we use a lot in tennis. Your hip flexors, your internal, external hip rotators, your ankle range of motion, your shoulder internal range of motion specifically. Those are some of the big ones. Thoracic rotation, thoracic extension, all of those are going to be really important to work on.
Thanks, Mark. Snowy has a ball recognition question. Interesting. Please suggest 2 ball recognition drills, assuming we already practice calling out shots to hit to us, deep, short, add, deuce. So please suggest 2 others. Do you use these, Mark?
Yeah, so that's a great question. So there's a couple things you can do. So you can actually cover one eye with a eye patch. That's always a fun drill for folks because it changes your perception. So that can help. And really what that's doing, that's just increasing your focus. It's just making you really pay more attention. So that's a really good one. The other one is mark the tennis ball. So sometimes we'll put a piece of tape around the middle of the ball, or we'll put a big colored dot on the ball that you can see, and try to pick that up as soon as possible. So those are 2 that really just force you to pick up the ball a bit sooner than you normally would. So those are 2 really good ones.
Thanks, Mark. Let's see. Rockchild, okay, stretching multiple times a day. I didn't know that. Thanks so much. Good stuff. Already excellent performance as always. We're learning a great deal. Thanks, guys. Thank you. Rebecca, any particular leg exercises for players with knee replacements on both knees?
Yeah, so obviously having knee replacements are really common now. Deal with it all the time. And it's usually the best thing that's happened to the people because they were in pain. It was discomfort. Now they don't have any pain anymore. The challenge now is you have way more function in the knee, but do you have strength and stability above and below it? Meaning that our calves need to get strong. Eccentric strength of the calf is really important. And then our quads and our hip flexors and our hamstrings and our glutes all need to get really strong. So you need to basically do what a pro would do to get their legs as strong as possible to now support the joint, which is super strong. So in the past, many times people's muscles were stronger than their joints, meaning that they were pretty strong, but their joints were giving out because the joints were weak. They had arthritis, they had ligament issues, they had tendon issues, they had meniscus issues. The joint was struggling. With knee replacements, your joint's stronger than the rest of your body. You're a bionic person now, which is awesome. But the rest of the muscles aren't strong enough now. So you actually have to do more strength training than someone arguably that doesn't have knee replacements. So you obviously have to build up to that and make sure you get with someone who's worked with people that have had knee replacements. But getting on a structured strength training program is the best thing you can do for that standpoint.
Yeah, I really enjoy the strength training aspect of it. Alexei again, the best shoulder exercises in the gym for a tennis player, and which shoulder exercises are better to exclude?
Yeah, so there's a lot you can do. There's a lot that are rotator cuff centric. Those are most of the band exercises that most people have typically seen. External rotation, internal rotation, 90 degrees at the elbow by the side, things like that. Those are all great, but they're mainly rotator cuff exercises. There's a lot more to shoulder exercises than just rotator cuff exercises. There is the ability to load and pull, meaning that we actually have the ability to use our scapula better. We can control the lower rhomboid muscles, which are basically the muscles underneath your shoulder blades. Can we control that more effectively? Can we get our posture better as a result so we don't get as much internal rotation and anterior shift in the shoulder, which increases our likelihood of shoulder impingement? So limiting pressing type movements, as we mentioned earlier, is one thing that you don't want to do too much of. You want to do more pulling, rowing activities, external shoulder rotation versus internal shoulder rotation for strength. So just be clear on this. So for stretching and flexibility, we want to do more internal shoulder rotation, range of motion. So more flexible work is needed on internal shoulder rotation. However, for strength, we need to do more external rotation strengthening work. Tennis players are typically much stronger internal rotation strength and much weaker external rotation strength. So we need to do more external rotation strength. In the converse, when we're talking about flexibility, tennis players are much more flexible in external rotation, mainly because of the serve. Dropping the racket down causes us to stretch that capsule a little bit and get more external rotation, but they're much tighter on internal rotation range of motion. So it's the strength side is the opposite of the flexibility side. And just be really clear on that and don't flip it. Too many people sometimes, I think, flip it and they over strengthen the area that's already strong, which creates a strength imbalance that is significant. And they become over flexible external rotation, which is not what we want. We're already very flexible there, but we have to work on our internal rotation flexibility.
So if we were to exclusively work on the internal rotation for flexibility and the external for strength, which is, I think, the way that we should be doing it, should we totally ignore the other aspects of those? So like the strength for internal, like if we didn't train that, would that be fine, or do we still need to train it, but just like very low fraction of?
Yeah, so I still like to put a little bit of load and a little bit of flexibility on both aspects, but it's usually a 1-to-3 ratio. So I'll do 3 times on one on the other. So, from a strength standpoint, I'll do 3 exercises external rotation to 1 exercise internal rotation.
Got it. Super helpful. Thank you. Baron Strategic Partners. I'm a senior player who plays 4x per week. What should I do on the days I don't play? Should I do anything besides stretch on the days I play?
So I guess my question is, do you do off-court training in addition to this? If you don't, that's a great opportunity to add at least 2 sort of off-court training sessions per week in those off days. That would be ideal because you want to make sure that you're strong, stable, you have that ability. Sounds like you're playing a lot of tennis, which is awesome, but is your body going to survive that for the next decade without taking care of your body on the off days? So my suggestion would be 2 days at least of off-court training where we're doing some strength work, we're doing a little bit of power work, we're doing quite a lot of mobility and flexibility and injury prevention.
Thanks, Mark. Liz, best exercises for tight hips / lower back.
Ooh, I got all sorts of good ones for those. But if you want to check out our program, Bulletproof Hips, there's a whole series of exercises, different progressions, because there's a lot. And a lot of it has to do with where are you tight and where are you weak and where are you strong, because that's one of the challenges with, say, yoga. Yoga in theory is great. It's like strength training in theory is great, but you got to do it the right exercises for the right person. There's a lot of exercises that are counterproductive or are making someone more mobile than they need to be in one direction, but they're not mobile enough in another direction. And having this discrepancy is typically where a lot of the injuries happen. It's not so much that someone's tight. It's a lot of the time that someone's tight in one area and looser in the other. And that creates this friction in the body that results in injury. So there's a lot of players that are tight in both sides. And in some respects, that's even better than being tight in one area and loose in another, especially if they're always fighting for joint position. And that's what's pulling on the hips or pulling on the lower back or things like that. So I never like saying, hey, this exercise is something everyone should do, or because we don't know your personal situation. But in general, internal hip rotation is usually tighter for tennis players. So spending time on your internal hip rotators is going to be really, really helpful. That's one that's really useful. Another is, for most people, again, unless you've got some significant issues that aren't common, doing a lot of back type exercises where you're bringing your knees to your chest. There's variations of those where you're lying on the ground, then with your feet up in the air, with your butt against the wall and your lower back on the ground, can be really valuable for some people as well. But you just got to be careful. If you've got back issues, check with your physical therapist or your doctor as to what you can and can't do. But that's a form of decompression that we use a lot with a lot of athletes. It helps a lot with hips and lower back stuff.
Thanks, Mark. And so, I've taken, I'd say, several yoga classes. Not as of recently. I just do the stretching, but I know you mentioned that there are some exercises that are counterproductive, and then you also did mention, specifics in regards to like the types of like movement in areas. But I mean, is there one like a common movement in there that you would say kind of alert us to say, hey, like this might be something that's you really
No,
might
it's
be.
just some of the
Okay.
more advanced positions sometimes. The back bends, holding positions for 3 or 4 minutes sometimes. That can be somewhat problematic for certain people. There's also the challenge sometimes with hamstring versus hip flexors, and really making sure that they're appropriate. So it's a lot of it is just the problem with general classes. It's not yoga specifically, but it would be the same in Pilates. It would be the same in a high intensity interval class. Everyone does the same thing basically. So you just got to be a little careful of, are those movements appropriate for you?
Gotcha. Let's see. Mike says, does the more flexibility in external rotation tend to hold for senior players? My static rotation is okay, but my dynamic shoulder external rotation is poor. Do you have to be an injury situation, you think, or something else?
Not sure what you mean by my static rotation versus your dynamic. I'm assuming you mean when you're playing tennis. So you're dynamic. Is that what you mean? Because static rotation, you can't really rotate while you're static. Static's sort of not moving.
Yeah.
So I'm curious what you mean by that. Maybe you can explain that a little bit more. But if there are individuals that have really restricted external rotation, which I see every now and then, that is usually due to a major prior injury, a surgery, something that's happened that has locked up the position. And that's a whole nother discussion. If you've got a prior injury that has caused external rotation to be restricted, or you've had a surgery in the past that's locked that up, that's a whole nother discussion in addition. So yeah, if you want to write back in and maybe explain that a little bit differently, I may be able to provide a bit more context.
Gotcha. Let's see here. Thanks, guys. It's a good presentation. I'm 77 years old, in good shape, but sometimes I forget to keep my elbow in while playing. Is that going to be a problem down the road? Is that a technical thing, Mark?
I'm not sure
Elbow in?
what you mean by elbow in on forehands, on serves, maybe a little bit more specific there and when you mean your elbow in. But if you're at 77, you're doing pretty well. So that's great to see first off. And if you got no pain and you're working on your body, you're taking care of yourself, a lot of the time, changing technique at that stage may actually cause more problems than it fixes because you've been able to get to this point with the technique that you have a lot of the time, and we see this in all sports, baseball, golf, you change your technique late in your career, it actually may create an injury or a problem because your body is so adapted to whatever technique you've had that you're trying to add something new late in how your body functions that it could actually throw you off. So you want to be careful about doing any excessive change in technique, if everything's feeling good.
Gotcha. Gotcha. Thank you. Thanks for the question. James, you mentioned hip internal rotation. What are some good exercises or stretches to do for that?
Yeah, so one of the ones that I use a lot is a pretty simple exercise. It's called a 90-90 hip exercise, or you're sitting basically on the ground with your hips and knees at 90-degree angles and your torso sort of sitting up. So if you're not, it's hard to describe a little bit on this, but if you look up 90-90 hip position stretches, you'll see it online. You can YouTube it. You can go to Kovacs Academy as well and put in the search bar hip stretches, and there'll be a few different blogs and articles on it as well. But in general, that's a good simple one that most people can try. If you've had major hip issues or knee issues, be a little careful. Like anything, getting down the ground, if that's a struggle for you, that may not be the right exercise for you. So just be a little careful about that. But in general, that's one. And there's a few others that'll get at that. One is lying on your back. If you put a rope or a towel around your ankle and your knee is off the ground and your heel is off the ground, you can slightly pull on your ankle. If it's your left leg, you'll pull left and you'll try to keep your knee and your hip in one position. And by doing that slightly, you'll stretch your internal hip rotators as well. So there's quite a few different ones, but if you look up internal hip rotation stretches, you'll see a handful that are pretty useful.
Gotcha. Gotcha. Thanks, Mark. I think we'll take one more question here. How important or should rec players incorporate plyometrics into their strength routines?
Great. Really, it's a lot of it is jumping, and start very controlled, very low height or low distance jumps, and then progress from there. So depending on your level of athleticism, prior injuries and things like that. But in general, just doing a two-legged jump for distance, just jump, as far as you can comfortably in front of you, jump as far as you can to the left, jump as far as you can to the right. That's a plyometric. It doesn't have to be more complicated than that. Over time, you can do, say, box jumps. Let's start with a 6-inch box or a 6-inch step, go up to 12 inches and progress from there. No one needs to be a hero out here where we're trying to jump, 4 foot, 5 foot, 6 foot boxes. You're not trying to create Instagram or YouTube videos. You're just trying to improve your performance over weeks and months gradually. That's the best way to work on this stuff.
Thanks, Mark. And Mike, just wanted to clarify static. He means when I'm stretching dynamics during racket drop, and he did have shoulder surgery.
Yeah, so the surgery may have a lot to do with it. When you're static stretching, there's no racket drop that's happening that's causing it. So you probably feel stiff when you're stretching static in that environment, even though you feel like you're getting the racket drop in the right spot. So that may be all true. There may not be any issue there, actually. It all is maybe a perception issue. Hey, it just feels tight. But when I'm on court and I look at it, my racket gets in the perfect position. If you're getting in the right position, you don't have any real restrictions in external rotation. You wouldn't be able to do it unless the only way you can sometimes is if you've got unusual thoracic extension, which some players do, and they have a little bit tighter external rotation of the shoulder, but they have phenomenal thoracic extension, and that makes up for some of that difference. That's very rare though. But it sounds like the shoulder surgery may have a little bit to do with it as well.
Yeah, yeah, definitely. Thank you, Mark. That was excellent. As I mentioned, everyone should click the button below this video to check out Kovacs Institute. But Mark, just wanted you to, educate the audience as well. If there's any other places that folks should check out, and also any projects or anything you want to shout out as well.
Yeah, so go to kovacsacademy.com. That's, we have hundreds of hours of content on that. It's all searchable by all sorts of topics, all tennis related. And then we also have our Kovacs Institute website, kovacsinstitute.com. We have a bunch of courses, long form courses there as well. So those are the two best ways to connect and contact me if you ever need anything. It's always great to see so many great tennis players out here and, staying healthy on the courts.
Yeah, definitely. And I know you have like a free course for analyzing the 8 stages of the serve. So that's when I learned about that, that was monumental. It's also, I mean, Mark wrote like a amazing, like in-depth, what would you say, is it called, like a paper on it or a
Yeah,
study,
it
I
was.
guess?
It's the most cited tennis serve paper out
Yeah.
there, peer-reviewed serve paper out there.
Yeah. Yeah. Pretty awesome. So, Mark, I want to thank you so much for coming on. I really appreciate your time. It was just fantastic, amazing to learn from you as always. So thank you so much, and for joining, and also thank everybody for watching. And yeah, all the best to you.
Awesome.
Thanks.